At this 2020 ESMO breast meeting, two important studies were presented. On one hand, the DESTINY-01 trial looking for the activity of trastuzumab deruxtecan in heavily pretreated HER2-positive breast cancer, and the HER2 CLIMB trial looking for a new standard of care after T-DM1 pertuzumab trastuzumab in HER2-positive advanced breast cancer. It was my privilege to present at this virtual ESMO breast meeting a subgroup analysis of the DESTINY-01 trial. So in this particular trial, trastuzumab deruxtecan was evaluated in HER2-positive advanced breast cancer patients. This particular drug has three components: a monoclonal antibody anti-HER2 agent, an topoisomerase 1 inhibitor payload, and a cleavable linker. So concerning the patient population, in the whole patient population it was 184 patients. They had received prior treatment with trastuzumab, they had received prior treatment with T-DM1, and most received also other anti-HER2 agents. The median number of prior treatment was 6. Patients at the recommended dose of 5.4 milligram per kilogram has been shown to have an objective response rate over 60%, which is of course impressive if you take into account how heavily these patients were pretreated. Now, concerning the analysis we presented, we looked to the 24 patients with a history of brain metastasis. This patient had received prior local treatment, but this was at least 60 days before entering the clinical trial. These patients were asymptomatic or don't need a specific treatment for the brain metastasis. And what we have shown is that the outcome was very similar to the whole patient population in the subgroup of 24 patients with brain metastasis. The objective response rate was almost 60%. The duration of the response was very long, about 17 months, and the overall survival, the median overall survival was over 18 months. Concerning the side effect profile, in general, the drug is well tolerated, mainly low-grade hematological or digestive side effects. But there's one important side effect to be known. These patients are at risk to develop interstitial lung disease, and for this it's important that we monitor closely this toxicity and manage it in an appropriate way. Now, based on this very interesting data in phase 2 in these heavily pretreated patients, now there are important phase 3 trials ongoing in different populations, HER2 positive or low expressing HER2 tumors, further evaluating the efficacy of this drug. It may be also interesting to mention that the FDA already approved trastuzumab deruxtecan after 2 lines of anti-HER2 therapy in metastatic HER2 overexpressing breast cancer. HER2 CLIMB is a very important phase 3 trial. This trial addresses an unmet need. On one hand, what is the best treatment after pertuzumab, trastuzumab, and T-DM1? And on the other hand, what is an active drug for patients presenting brain metastasis? And this is a current problem because about 50% of HER2-positive advanced breast cancer will present brain metastasis during the course of the disease. So in this trial, over 600 patients were included. They had all been pretreated with pertuzumab, trastuzumab, and T-DM1. Patients were randomized to receive trastuzumab, capecitabine, and a placebo, or trastuzumab, capecitabine, and tucatinib. Tucatinib is a tyrosine kinase inhibitor, and importantly, with minimal anti-EGFR activity, And this is important for the safety profile of this drug. Now, concerning the patient population, it's important to have in mind that in this particular trial, patients with brain metastasis can be included, and not only patients with controlled disease, but also patients with active disease. At the end, almost 50% of the patients included in this trial present brain metastasis. Concerning the primary endpoint, progression-free survival, they report an increase from 5.6 months to 7.8 months. Also for the median overall survival, there is an advantage if the patient received tucatinib instead of placebo, with an absolute difference of 4.5 months and a median overall survival of almost 22 months. And also concerning objective response rate, there is an increase from 23% to 41%. Concerning the safety profile, toxicity is mainly diarrhea, hand-foot syndrome, but this is related to capecitabine, not to tucatinib, and then also liver test abnormalities. But these toxicities are in general very well managed. The discontinuation rate because of toxicity was very low in this trial. I think it's also important to mention that based on the outcome of this trial, the FDA has already approved this drug now for metastatic HER2-positive breast cancer who had received at least one line of anti-HER2 therapies.